they're very attentive to what everybody needs. The nursing staff is amazing. They make sure you get what you need to make sure that you're not feeling miserable all day long.
They gave me a plan of care. They started me on medication immediately. They told me what to expect.
It is the hardest part, but you will get over it and you will be comfortable through it.
I mean, everybody couldn't have been more friendly and helpful. Again, realizing just the kind of state of mind that we arrive in and how we're going to try to transition away from that.
People who use drugs or alcohol on a daily basis can become physiologically dependent on these chemicals. Regardless of what people will tell you, anything from as simple as cigarettes to alcohol to even kratom and gas station supplements and things out there, if they're used consistently at a high enough level on a regular enough basis, your body can become physiologically dependent on these chemicals. What happens when a person tries to stop or decrease or lower the amounts of use of these chemicals, you can have a withdrawal process, which physiologically means your body feels like you don't have something inside that you need.
The goal of Detox for us is to safely help your body not require the substance any longer. We want to do it as safely as possible and honestly as comfortably as we can for each patient.
So one of the things we do is incorporate the highest levels of medicine and science we have available to us at this time to treat people and to manage them through this time period. For some patients, this can be anywhere from 24 to 48 hours of a withdrawal process. For a lot of patients, it can be anywhere from 5 to 7 days, sometimes longer for a real withdrawal and detox period.
When a patient first gets to us in Detox, they go through a pretty extensive intake process. They are seen by one of our medical practitioners for a full history and physical. They are seen by one of our psychiatric practitioners for a psychiatric eval. The nurses do their evaluation of the client as well. The therapists come through and do assessments. We draw a set of admission labs. And then after that, protocols get put into place depending on what substance the client is detoxing from. And then we follow those, and the client is monitored throughout their time with us in Detox. And when the team feels like they are detoxed and they are ready to enter general programming, we get them moved out.
Early Sense was approved by the FDA in 2009 as a non-invasive way to monitor people in their beds. Typically, they started originally with intensive care unit, but we're the first adopters to really kind of think outside the box with that and really apply it to all our detox beds across all our facilities in the AC family.
Early Sense monitoring, that is a monitor that goes underneath the mattress, and that monitors all the patient's heart rate and breathing while they are in bed. So if anything is out of the ordinary, we're notified immediately so we can go assess them. And then there's also a fall risk monitor on the bed alarm, to where if they're a fall risk, we can turn that feature on, and if they try to get out of bed, we're notified immediately so that we can try to get to them before to prevent a fall. And then we also do hourly checks on patients. We lay eyes on them every hour.
So primarily the medications that are used are Ativan, which we use a lot for benzodiazepine withdrawal and medical detox. We also use Ativan for alcohol detox protocols. We use a lot of buprenorphine, primarily for opioid detox and the opioid detox protocols. Those are our primary medications that you would consider to be your quote-unquote detox medications. Now, there's a lot of other supportive medicines to the tune of around 15 or 20 different prescription medications that we can use to also treat other symptoms as they develop. Nausea, vomiting, diarrhea, upset stomach, insomnia, muscle aches, cramps, restless legs. I mean, fortunately now with the pharmacy benefits that we have and the medicines we have available to us, we have a lot of different medications we can use to treat the multitude of symptoms.
You rest, they help medicate you to alleviate a lot of the symptoms that come with in detox. And then you're surrounded by other people that are going through very similar things. And so you have a bond there with them.
The detox area, they watch you all of the time. They're there for you all the time. The nurses are always there to help you with that. Follow direction and you'll be fine. But if you have a problem, they'll be there for you.
If you're going to be somewhere, right, it's almost, I mean, there's a nursing staff, there's doctors, there's psychiatrists, so if something's going to happen, you want it to be here.
Our goal every day is for everyone to be safe. We want people here and we want to help. We want to stop that and we want to do it in a way that is so safe for everyone. And that's what we strive to do every day with our protocols, with our medications that we use, with the monitoring that we do, with the training that we all get regularly. We believe that we are a very safe facility, and we'd love people to come in and get the treatment they need.
You know, I wish I would have done this 10 years ago because it's a short period of time for the rest of your life to take a step like this.